Hi, everybody. I'm Sally Guttmacher. I'm a professor at NYU. I teach reproductive health. This meeting is to talk to students in public health, not only reproductive health, about why you have to vote. You've got to vote, and before you vote, you've got to register. So you've got to register and vote, okay? And I think we can all see that public health, the field of public health, is really enmeshed in politics, and more than many other academic fields. We can see that in New York City right now, where there's a struggle going on in certain boroughs of the city. Policies have been put, I guess, are put out by the governor and the mayor about related to social distancing, and there seems to be struggles against this policy. And we on the side of public health have to understand what's in the interest in terms of the health of all of us, of the public. And in fact, I decided to go into this field of public health because it seemed to me to be really involved in many aspects of things that go on in the United States, some of the political issues that go on in the United States. Public health has always been political. Now I'm going to try to remain nonpartisan in this because it's somewhat hard for public health, given that a number of institutions of public health have been attacked recently for political reasons. The Morbidity and Mortality Weekly report that we rely on, certainly when I teach epidemiology, rely on, has been manipulated for political reasons. The CDC has been manipulated, or attempts at manipulation of the CDC have occurred for this during this the recent period. And that has to be of great concern for any of us who are in public health. I teach reproductive health, reproductive rights, and of course, reproductive rights are under attack. I don't have to tell you, I'm sure everybody knows that there is going to be, and there will be, an attack on women's right to choose, which is a reproductive health issue, and attacks on Planned Parenthood, which is a important general source of care for many women who are low income, and so that's a great concern. And then there's issues related to environmental health and climate change, which are also very important issues because the change in climate has an impact on the public's health. So all of these come together, and they should be issues that you are involved in and think about as people in the field of public health. Now today we're going to talk about voting because that's one of the steps you can take to support your field and your feelings about public health. And we have people who are going to talk to you about some of the issues related to voting. And just to say that it doesn't matter which party you belong to, you do have to vote. And once you've voted for that party, you're committed to making pressures on that party to do whatever needs to be done in the interest of the health of the public. Okay, and with that, I'm going to introduce Campbell Streator, who's going to talk about some of the issues focused on voting in public health. And let me say that before we start, that you can ask questions through the chat room, I think, at any time while we're talking, and then we're going to field those questions at the end of the presentations. Okay, Campbell?
Awesome. Thank you, Sally, for the kind introduction and for setting this up. As I said, I'm Campbell Streator. I'm the executive director at Every Vote Counts. We're a student-led, nonpartisan organization dedicated to increasing voter turnout and expanding voter access nationwide, something we go about by supporting students doing civic engagement work on campuses around the country. And we work with students on about 50 or 60 campuses as of today. I'm here to talk to you all a little bit about some resources and tools that can help you as students in public health navigate a lot of the hurdles that exist for students in voting. If you actually look at some of the data, there's this kind of myth about young people as apathetic voters, and it is true that young people vote at lower numbers than some of our older counterparts. But a few things interestingly about that. One, young people actually register, and students in particular, at rates that are more or less commensurate with the general population in the United States. The big challenge actually comes in navigating going from getting registered to showing up at a ballot box. And a lot of that has nothing to do with apathy, whether or not people may like you to tell that. It often is navigating legislative hurdles, practical hurdles. Young people are more mobile in a different stage of life than many people. So it's tricky, but I'm here today to try and talk to you guys about a few tools and resources that might help you do that. So I'm going to share my screen quickly. Fantastic. So I'm going to talk about tools in 4 categories. The first is registration. The second is planning to vote. The third, voting by mail in particular, and then just some general tools that relate to civic engagement more broadly. On the registration side, there are tons and tons of online voter registration tools and resources out there. NYU may or may not have specific ones they'd like you to go to. I think the NYU Votes website channels into vote.org, but TurboVote is another option. Register2vote.org is a third. And another one I like as well is allin2vote.org, which is organized by the All In Challenge. And they're just great resources to register. Check if you're already registered, that if you need to update your registration. And especially with NYU being in New York, today is the voter registration deadline in New York State. So if you plan to vote in New York, make sure you either register or update your registration today by the end of the day. And if you're in other states, the deadlines are really starting to pass a lot more quickly over the next few weeks. There's a big batch at the start of this week and another big batch coming over the next few weeks. Voting by mail has come up a lot in the last few months, and for good reason. More people are eligible to vote by mail this year than have ever been before, and it is very likely that more people will vote by mail than ever have in American history. It is safe, it is secure, no matter what you may have heard from various people in debates or in the public narrative. The fraud rate on vote by mail is very, very, very small. It's something of 0.000005 or something like that. So it is safe and it is secure. That said, depending on where you are as a state, you will have to likely request a mail-in ballot or an absentee ballot. And this QR code will take you to a very cool tool that is embedded in the EVC website. It was built by a group called Ballot Ready, which we'll talk about on the next slide. It makes it very easy to request your ballot if you're not going to have one mailed to you automatically by your state. All you have to do is provide your email and your address, and they'll loop you in to your state Secretary of State, whatever that process might be. And just as a general point, when it comes to all of this information, your state and local elections officials and their websites are one of the best places to get information directly from the source. They know what the rules are, and if things are changing, they're up to date on them. So that's your best source of information. And lastly, as I talked about a little bit before, navigating those hurdles from actually getting registered to casting a ballot are particularly important for students and young people all over the country. And here's a few tools that are designed to help you navigate that process. The first, this kind of image of the voting guide, is from the Campus Vote Project. They put together state voting guides for all 50 states. So whether or not you're registered in New York or a student from elsewhere that is registered at home or wherever you might be from, their website has tons and tons of very valuable information navigating what you need to register, what you need to vote, what kinds of IDs you might need, and any of that information, so you can be prepared and have a plan to go about that. And speaking of having a plan, that brings me to Ballot Ready, which is a very cool tool. You can go to their website, or you can access it through the QR code in the last page. The Vote by Mail engine also has a Make a Plan to Vote engine. And they make it really easy to make a plan to vote. They'll tell you where your local polling place is, where any drop boxes might be if you're voting by mail, and they also make it easy to figure out who and what is on your ballot. 100% nonpartisan information to back it up, and they really make it easy to know who or what you're voting for. Similarly, Vote 411 is a similar tool put together by the League of Women Voters, a great nonpartisan organization that does tons and tons of research to provide information about who and what is on your ballot. And lastly is the 866 Our Vote Election Protection Hotline, which is a great place to go if you've run into any problems while voting. They have a text tool, they have an online chat tool. You can call that number if you run into any issues while voting. That's the one-stop shop to go. It's manned by lawyers all over the country. It will help you navigate any and all problems you might face. But all this is to say, this year more than ever, figuring out that you're registered, how you want to vote, whether that's in person early, if that's an option in your state, by mail or on election day. Figure out what you want to do and what works for you, and then figure out how you're going to do that. And some of these tools can make that really easy. One more tool I would like to point you all towards that I think is pretty cool, and you all as public health folks might find particularly interesting, is a tool called Issue Voter. It's an online tool that makes it really easy to keep your elected officials accountable on the issues you care about. So as folks that might be interested in public health, reproductive health, any of those related issues, you can go to Issue Voter, you put in your address, they tell you who your officials are, and then you say, these are the issues I care about, and then they'll track those for you, and anytime a bill comes up related to those issues, they'll give you a notification, and you can reach out to send your opinion directly to your rep and see how they vote on that in the end. This is more just getting to the point that civic engagement is broader than just registering and turning out to vote. It's a lifelong habit. It's something that can happen outside of the 4 years of a presidential election or the 2 years of midterms. It's happening all the time at the local level as well. So just a great tool for really actually staying on top of a lot of that stuff. And lastly, as I turn it over to Robbie, who's an NYU student, I'm going to talk about some of the opportunities you have to get involved in, stay engaged at NYU in particular. Just a reminder, if you're planning to register in New York, the deadline is today. Make sure you register, request a ballot, and find your polling place. And you can do a lot of that on the NYU Votes website, which is what this QR code will take you to. And with that, I'll turn it over to Robbie.
Yeah, thank you, Campbell. Hi, everyone. I'm Robert Lopez. I'm the president and founder of GenVote at NYU. We are a student-led voting rights group, and we pretty much started, late 2019, spring of 2019, around the idea that we need to make civic engagement a priority at NYU, and that's what we set out to do. And in collaboration with the work of the NYU Votes Committee, we've been able to accomplish a lot. And I just want to talk a little bit about that. First of all, today, this year is going to be historic because actually for the first time in NYU's history, there's going to be an early voting site on campus. NYU's Skirball Theater will be an early voting site for the November election. And this is actually, once again, going to be the first time in NYU's history that there's going to be an early voting site. So make sure to check out if you're registered in New York, if you can actually, if Skirball is your early voting site. Second of all, for the first time in NYU's history, there's going to be academic accommodations for students to actually go out and vote. This is after a long, hard-fought battle over getting students some time off to vote. And pretty much that means that, for example, any global public health student can now ask their professor for an excused absence to actually go out and exercise their right to vote. So that will be happening this year. In addition, I want to talk a little bit about the importance of, it's not just about voting, but it's about doing what we can to protect our elections. And that means, going a step further. And so, what us at GenVote at NYU have been doing, and we're working with the Wagner School of Public Policy, is to actually fully fund paid roving poll watchers and social media monitors to make sure that polling sites are protected, that make sure that there's no voter suppression. That means making sure that there aren't any long lines, making sure that polling sites are accessible, and monitoring social media for keywords such as long line, voter suppression, anything to do with disinformation or misinformation, So that's what we've been doing, and this has been in conjunction with the amazing work at NYU Votes. NYU Votes is this administration, faculty, and student combined run program that pretty much allows us young people to get involved and ask our friends to register and pledge to vote. And that's really so important, is not just, hey, register to vote, but hey, what's your plan to vote? Talking with your friends about going out to vote and doing it together if possible. So these are just some of the things that NYU that we're trying to do to make sure that we can actually turn out and get out to vote this election and do more if possible.
Great. So I think that's been two really good presentations, but we're open to questions. Zach, has any questions come in at this point?
So right now we don't have any questions submitted from this webinar's audience, but we do have some questions that were submitted previously while registering for this webinar. We have a question from Harilka Husky, who is an NYU undergraduate student studying global health. And her question is, how do you see the future of reproductive health shifting as either of the presidential candidates become elected?
I see it, if Trump is elected, I see it very clearly shifting in a way so that women have less reproductive choice, that abortion will become much more difficult. It will become sort of a state issue, state by state. And some states, I think, will still allow abortions. I don't know whether the federal government can affect what a state does, because I think that could be a state issue. So that will be a problem. If the Democrats win, I think that we will be more or less, women's right to choose will be protected, that Roe will be protected. I don't know, I'm sure if the Supreme Court becomes more conservative, then they will probably, it's likely, turn over Roe, and it will become a state issue, I think, that states themselves can make the decision. And of course, other issues about reproductive health, as I said, Planned Parenthood, which is an organization which serves a very large number of people who are low income. If Trump and his group wins, and they have said they're going to defund Planned Parenthood, I suspect that those people, those women, will be in a tough space, because it's hard to get, if they don't have some other kind of insurance, to get reproductive health care. If the Democrats win, I think that will not happen, that Planned Parenthood will continue, and so that those women will be served. So I think that that's where it is now in terms of the Democrats versus the Republicans. If the Republicans win, it's going to become much more difficult. It's also going to become much more difficult for countries outside of the United States that we have been funding for reproductive health. You know that Trump has instituted the gag rule, which means that any organization cannot get U.S. funds if they even if they recommend people for abortions. I think if they speak to them in any way about abortion. So we do a lot of global funding, and I think that that's going to be a problem if the Republicans win. I think that money will be cut even more severely than it has been cut, and that some of the agencies that fund, like USAID, will have their budget cut in relation to reproductive health. So I think that's sort of the situation now.
Okay. Thank you so much, Sally. And also, I'd just like to remind our audience that please, by all means, if you have any questions at all related to what's at stake for reproductive health in this election, please, by all means, ask your questions in the Q&A function. But Harilka, keeping with the international theme, she has a second question. What are some of the direct impacts of President Trump's lowering of the refugee admission ceiling And how do you think these ramifications might affect the future of women's and reproductive health?
I mean, what he's done is to obviously make it much more difficult for people to immigrate to the United States. And a lot of immigrants have been women, either for various reasons, to do various kinds of service work in the United States. So they will not have access to the kind of health care that they have had, would have access to in the US, and sometimes don't have access to it all in their own countries. So it's not going to be helpful to them. And that those immigrants that are here will not have access to any of the kinds of financial support. So they'll be on their own, and that's going to make it much more difficult for them and for the rest of us, actually. So I think that that's the kind of impact it's going to have on. It's going to have a negative impact if Trump wins. It'll have a negative impact on the reproductive health of immigrants, either those that are here now or those that want to come here. Okay.
Great. Yep. Thank you, Sally. And I know we touched on Roe v. Wade and Planned Parenthood a little bit, but just to go a little bit further into both of those, Cassie Nidzila, who is an NYU undergraduate student studying global health and sociology, has a question. In the context of the recent Supreme Court vacancy, what is at stake in terms of abortion access and access to reproductive health services under the Affordable Care Act?
Well, it looks like the Affordable Care Act, the Supreme Court, I don't think will have a major impact on the Affordable Care Act, because that does go through Congress. I think if the Supreme Court becomes more conservative, it is very likely that they will try to overturn Roe. Whether they will be successful, whether all of the justices will maintain their strict conservative positions on this, if that's true, Roe will be overturned, and then it will be up to the states, and the struggle will be on the state level, the state political level. So for those of you, this is not just about, this voting is not just about voting for the president. It's also about voting for your state legislators, because they are very important in terms of a lot of policies that affect people immediately on the ground. So don't just think in terms of the president. It's important that you vote, because it's very important that you vote for your Congress and senators too. Okay, Zach, are there any other questions now?
I just received one from Cassie. Thank you so much. What are some things that public health students can do to protect reproductive rights aside from voting?
Well, I think that, I mean, you can work, go to work in one of the, in the field if you want to. If you want to work in women's reproductive health, there are a number of organizations that public health people work in other than Planned Parenthood. So you can think about your career, and I think that's very important. And you can work on the state and local level, because I think a lot of what's going to happen now is that this is going to come down to struggles at the state and local level. So you can work with your congressperson, you can work with your senator, you can offer your support and services in some way. So that's what I think can mainly must be done, is to, we are not public health people, we're not practitioners, right? We are more directly, in fact, involved in policy and issues around that, and that's what you need to do. You need to get in touch with your local legislators and begin to work at that level, I think. Anything else, Zach, that's coming up?
No other questions have come in right now, but I actually have a question I think that can spur some conversation. I know early in the semester we had a webinar regarding the impact of COVID-19 and reproductive health. And I think COVID has impacted, every aspect of our lives, but especially this election. So I think maybe if, Sally, if you can just review some of like the 1 or 2 key points of how the COVID-19 pandemic has impacted reproductive health. I think that would be great for the audience to review just really what the state of it is right now and how important it is to vote.
Well, of course, COVID has taken, taking a lot of resources, and that's something to think about. But and it's also increased the, the protection from COVID is obviously social distancing and wearing masks and washing your hands, and those are the best prevention methods that we know about. How it affects reproductive health is that, first of all, when there was a real crisis, people were not encouraged to go to see their doctors or go for medical care. I think that that crisis, at least in New York, where we're located, is over. And I think that people need to go and see their medical, go for their medical care when they need it, and not feel that they are banned from going to health services, and you should do that as long as you're careful with your, careful. So I think that it's not, it put a damper on people seeking health care for a while, but I think that that's, at least in New York, that's not the case. Zach, were there other things that you can think of that we talked about in that seminar?
I would just say probably also bringing to light the fact that the COVID-19 pandemic has increased domestic violence rates severely from, everyone having to stay at home. And also a good thing, I guess, that the COVID-19 pandemic has spurred is the increase in telemedicine, where certain kinds of people now have better access to referrals about birth control or any kind of reproductive health medication, but there is also the digital divide then of who has access to telemedicine. And I think that leads right into, we have another question come in. The digital divide leads right into this. Can you talk about racial disparities in reproductive health and how they can be minimized?
Racial disparities can be minimized if people have, first of all, insurance to cover the services they need. And it's often that people at the lower income level do not have the insurance to cover their needs. So that's obviously an issue, because that affects more Black and brown people and also white people who are low income, who are going to have less access. And if Obamacare is overturned, that will mean they even have less access. I think that the Supreme Court has approved the notion that if the owner of a company doesn't approve of abortion, that they cannot get insurance through that company. And so that leaves a lot of women who are working for various large companies or even small, have to shoulder the burden themselves. I think that the telemedicine issue is a very important one. And one of the important ones around telemedicine is around the issue of abortion, because now you can get abortifacients. You can get a prescription for abortifacients over the phone. It's certain medications that you take. And there's going to be a big fight about that. There's going to be more and more attempts by the Trump administration or the conservatives to stop allowing people to get medicines, particularly the abortifacient medicines, without going to a regular clinic. And of course, clinics are closing, so it's harder and harder to go to clinics. So the best way to do it is through telemedicine. And I think now about a third of abortions are done through telemedicine. So that's important. We should really support it. I think the conservatives are going to try to really attack it at this point because they see that that is a way that women are getting some, certainly women who want the right to choose are getting their services. So I think that's what we're going to see. We're going to see a big struggle about telemedicine coming up. Okay, Zach, any other questions on that?
Yep.
Comes?
We have one from an anonymous attendee. With primary care providers taking such a substantial hit because of COVID-19, do you think they will be able to recover to be able to provide reproductive health care at the same rates as they did before the pandemic? And how can voting impact this either positively or negatively?
Well, yeah, I mean, I think everybody's been affected by COVID. I mean, obviously, I think it's pretty clear that the Democrats are trying to be more supportive in terms of resources, both for individuals, and I suspect they would be for healthcare providers. And so I think that's one of the things I mean, healthcare and health insurance and Obamacare have been very important issues for the Democrats. Trump always says that, oh, don't worry, he's got these great healthcare plan, but he never says what it is. And we have not heard of it at all. So I wouldn't think you could rely upon that. And I think that providers, I think that if clinics are not overwhelmed, if COVID does not come back, if there's not a second wave of COVID, that clinics will not be overwhelmed, and that reproductive health and health providers will not be overwhelmed, and that we will be able to get reproductive health care pretty much the way it was before we were attacked by COVID. Okay, Zach, is there anything else that we've got?
Yep, we got some more questions coming in now. So another question that we have is, to what extent will the withdrawal of the US from the WHO impact global reproductive health?
Well, the United States is the major supporter of WHO. It gives billions of dollars to WHO. The withdrawal of the United States from WHO will have a major impact on all of the issues, health issues that WHO is dealing with, and reproductive health will be one of those. Withdrawing from WHO is a very painful thing to think about for those of us who are in public health, because it will affect public health in a variety of ways, and certainly reproductive health. It will mean that there is less resources for health care, and including reproductive health care, all over the world. And so it will have a major impact. And I don't think if the Democrats win, they're not considering withdrawing from WHO. Okay.
Great. And we have another question that just came in. This anonymous attendee says, hello, I would love to hear your opinion, Sally, on reproductive health education for our young people. Especially with COVID, schools are removing sex ed mandates. How can CBOs and other YSOs supplement this, and how can clinics and providers reach young people? Thank you.
Well, that's a very tough question. Sex education has always been very problematic in the United States. In some states, virtually there's been really a hold on any kind of sex education. And part of it is to do with, we need to educate parents also, because a lot of parents are fearful that if they provide sex education in the schools, that will promote sexual activity amongst young people. And that's not shown to be the case at all. And I was very involved myself. I did the evaluation of New York New York City's condom availability program, which was, you know, about 20 years ago, I guess. And what we found was that making condoms available to students in the school, the students that availed themselves of condoms were students who were already sexually active, not students who were contemplating becoming sexually active. And for that's a good thing, right? Because that's a public health measure. I don't know what CBOs, what various organizations could do is to try to, you know, influence the communities that they're in. I mean, the problem will be that there will be always people coming along who are much more conservative about it and fearful that once this kind of education gets going, that it's going to, you know, make young people sexually active. So I think that they can be supportive in terms of recommending to young people where they can go for reproductive care, send them to Planned Parenthood. Hopefully Planned Parenthood will still be going, and just having an open view about sexual activity, about education for young people about sexual activity. And that's what I think is the best thing that the organizations can do. And maybe work with, hopefully, I mean, some of the schools do have good sex education going on, and hopefully some of the organizations can provide support for these schools, and maybe offer them to send in educators who can work with kids in the classroom. Okay, Zach?
Yep. Great. We don't have any more questions from our live audience, but going back to some of our pre-submitted questions, I know we did talk about career choices and how students can help. So Jocelyn Molina, who is an NYU GPH student in global health, asks, should these projections shape one's career choice? Should more people move into C4 organizations over C3 organizations?
You know, that students have to go where their heart is. They have to enter, to decide to work in an area in which they're really interested, and should not go into an area in which for other reasons, if you want your work to be exciting and interesting for you. I don't know, I can't predict the future. I think that if the conservatives win, there's going to be a big struggle on reproductive health and less funding for reproductive health, and less positions, less open positions for people to work in the field. So I think that that's the way it's going to be. If the conservatives do not win, if the Democrats come in, then I think there's going to be a lot of openings in reproductive health, and I think that there are a lot of agencies around that will support people working in that field, and that it will be, you know, you should go to decide to do something that you're really, really interested in doing. Okay, Zach?
Yeah, and I think that's a beautiful way to end it, because I have no more questions on my end, Sally.
Okay, and I guess the point is here, people, that, you know, no matter what party you support, you can still do important work in public health, because you need to pressure your local politicians, your city, your state politicians to support measures that enforce or support the health of the public. And that's what we're doing. That's what we're doing here. And I wish you all the best. And certainly, this is a very important time. Please vote. Do not hesitate to vote. One of the problems has been that a lot of young people register and then they don't vote. So you've got to make a plan, make a voting plan. Know what you find out how you register. If you register in New York, you got to do it today. You can do it online. You can do it. I think that's probably the best way, or you can go to your local motor vehicle office if you have one and you can get there before 5 o'clock or whatever, but you just have to register, and then you have to make a plan to vote. And you can vote early, You can vote. You can vote by mail if you feel that you want to do that. You can vote in person. You can go with your friends to vote in person. And so if you have to stand in line a long time, you can have a good time doing it. You know, bring your cell phones and something to eat and stand in line and talk to your friends and just make it a voting party. Okay, but do it. And do it because you're in public health, and that's what's going to make a difference in public health.